most of the metros are showing us what we're calling the hotspots. That means we have to find mechanism to go into those areas to deal with these particular outbreaks more strongly to reduce the rate of spread. Because Western Cape at this point is just below 50% of the total. Now that means we have actually got areas of outbreaks in a number of areas, particularly when I talk about the factories, some of the shopping centers, shopping complexes, and so on. So we will be visiting Western Cape to give them support, and at some point during the course of next week, the President also will be paying a visit as he has been going around visiting various provinces, and that helps to strengthen our teams on the ground. So we will be working with them, and we will be going to look at what additional reinforcement needs to be done in the Western Cape. We are concerned about the fact that we need to try and rein in the increases that we are seeing there.
A very good morning to you. Thanks so much indeed for joining us, and welcome to the program and this week's edition of Health Talk. Now, today is day 44 of the South Africa's national lockdown, and day 9 of the level 4 in response to the COVID-19 global pandemic. The WHO, the World Health Organization, held a media briefing on the 6th of May, that was Thursday this past week, to update the public on the COVID-19 coronavirus pandemic. Now, according to the UN Health Agency, major gaps in public health investment is undermining the health and welfare around the globe. Top WHO officials have frequently stressed that fighting COVID-19 requires a comprehensive approach, including health systems stocked with adequate and trained staff. Now, strong health systems are just one of 6 elements, along with contact tracing, that WHO officials have identified as being essential for managing the virus's spread, regardless of the transition phase. So that's the WHO this past week. But coming up on the program today, we are going to be joined by the health MECs in the Western Cape, the health in Northern Cape, to help talk to us about the situation on the ground and the plans that they've put in place to deal with the COVID-19 pandemic. We'll also hear from 2 women in the Western Cape who will give us a first-hand account of just some of the challenges that they've been facing during this difficult time. Then the personal journey of one of our reporters in the Northern Cape who got infected with the virus but has recovered. And that's all still to come. But first, our senior producer, Zama Buthelezi, will take us through the latest global and South African coronavirus numbers. Zama, good morning to you. How are we looking globally?
Globally, Peter, we're looking at coronavirus cases at 4,014,500, and that's at 276,253. Recoveries, just a little bit of 1 million. It's 1,387,259.
All right, so let's narrow things down a little bit to the Republic of South Africa. How are we looking here at home?
It doesn't look good at all. Just last night, we were told that the department has recorded at least 663 new COVID cases, and this is the highest number since the first case was reported in March, with Western Cape leading at 4,497. It doesn't look good in this metro. Gauteng following at 1,851. KwaZulu-Natal at 1,253. The Eastern Cape at 989. Free State at 133, Mpumalanga at 60, Limpopo at 43, Northwest at 42, and Northern Cape at 27.
All right, so that's quite a thing, though. It looks as if these numbers are rising quite drastically, Zama. What might be happening?
Well, Peter, you look at the positive cases in the whole country. We have 8,895, and the tests that have been conducted so far, we're standing at 307,752 recoveries. At least we are now on 3,153, but the numbers of deaths continue to rise. We are standing at 178, and active cases of COVID at 4,103. It doesn't look good at all.
All right, thanks very much indeed, Zama. All right, so that's the situation in terms of COVID-19 and the stats across the country. Now, don't forget, in fact, you've got, in fact, what you can do, now listen to me very carefully, you can be part of trying to manage the situation here. And if you all do what you need to do in terms of washing your hands, social distancing, and using sanitizers, would be fine. But as I said, that's the COVID-19 situation for the moment. But please note that we do observe and report on these numbers, and these numbers are changing quite significantly. In fact, literally overnight, they seem to be moving quite a bit, and you can help flatten the infection rate curve following the regulations set for the lockdown. Don't forget also, you can be part of the show by asking our guests some of the questions on your mind, and you could simply share your views with us on what we're discussing, and you can do that using our number, and the telephone number to use is Johannesburg 011 714 5861 or 5877. That's Johannesburg 714 5861 or 5877. Okay, so the question of the day, this is what we'd like you to look at and perhaps share your ideas with us, is: has the easing of the lockdown to level 4 made lives any easier, particularly with access to healthcare facilities in your communities during this pandemic? Okay, and you can share your thoughts with us on social media via Twitter using @SABC Health Talk, or also on our Facebook page, SABC Health Talk. You can also send us your voice notes or video messages on our WhatsApp number, and that's +27 65 862 4548. That's 065 862 4548. And please try and keep those messages short, under 30 seconds if you can, so that we can get as many as possible. And yeah, we look forward to hearing from you and seeing you if you send us a video note. Okay, I'm Peter Ndor, and Health Talk continues right after this.
We received information that these suspects were making fake permits.
It's not only for informal trading. It does permits for moving around, moving from province to province. So that defeats the whole regulations of the national lockdown.
I was arrested for 4 hours, but I proved myself that I did not issue any permit.
3 suspects arrested. 1, the owner of the internet cafe that was selling fake permits.
Pensions and disability grants have turned out in large numbers today.
From morning at 6 until now, we are still queuing on long queues.
The police were supposed to be here just to make sure that people comply with the social distancing.
We are still seeing a number of people in groups disregarding the social distancing.
When we get information in WHO, we get information in numbers. This many people died, or this many people had been infected. We don't see the numbers. We see the individuals behind the numbers. The mother of somebody, the father of somebody, the daughter of somebody, and the son of somebody, or the grandfather of someone. This virus is dangerous. This virus is public enemy number one. If we take this as a common enemy for humanity and give our best, we can win the fight.
Welcome back. You're watching Health Talk, and we're now starting to put a little focus on two provinces today. And we start with the Western Cape, which seems to be the worst hit province in terms of number of infections and deaths reported. Now, the province's Premier, Alan Winde, gave a media update on the 7th of May on the situation in the province. Let's take a listen to what he had to say.
The stage that we are in the Western Cape is community transmissions. This is where this virus is being caught through those interactions at your local store, when you're gathering to get your grant, anywhere where people gather. That's where those transmissions are happening. And so please, my message is we must continue while we are still getting those extra beds in place, while we are still finishing with our health response. I really implore everybody, make sure you follow the mask, the social distancing, the hygiene practices, because we've got to keep the growth of this virus in a controlled manner. I'm saying it is doubling every 8 days, but we can't afford for it to double every 6 days. And so everyone needs to play their part, responsibility as citizens, and of course we as government are working day and night to make sure that we've got the best response possible for you as citizens as we move to the peak, which is going to be with us in a very short while. In a good few weeks, we're going to be at that peak, and we've all got to be playing our part so that we manage that as best as we can.
So that was the Western Cape Premier, Alan Winde, with his update just a couple of days ago. The Health Minister, Dr. Zweli says that he'd be accompanying President Cyril Ramaphosa to the province next week. Now, to talk to us about some of the challenges in the province, we're now joined by the Western Cape Health MEC, Dr. Nomafrench Mbombo. Thanks so much indeed for joining us. Welcome to the program, MEC.
Thank you, Peter. Thank you very much. Good morning.
All right, so, perhaps you need to help us and explain to our viewers what it means, because I would have thought that Gauteng, being much larger, and maybe even KwaZulu-Natal, would have more in terms of statistics than the Western Cape. How is it that the highest number of infections and deaths are now in your province?
I think you must also understand that the national has already done some of the projections and the modeling to look at the worst scenario in the country at large of cases where it has been determined that by August, September, end of August or early September, that's where the country might have almost 50% of the people who will be infected. And they also, other researchers, they say it could be about 2.3 million or so. So in South Africa, we will have such. And then in the Western Cape, our experts, they did modeling specifically as the virus impacts differently across populations. That the 80,000, which is around June, is what is projected. So one might not necessarily be surprised that we are going up because the projections is what determines. But we are also concerned that it's coming earlier than expected. Also noting that in the Western Cape, most of these, it came from the cluster groups. So where a large number of people got infected more or less at the same time. Just making an example of the cluster groups, the shopping center, where you find that over 300 people were initially infected at the beginning stage, where one shopping center will have 50 people positive. Also in the space of the factories, essential service workers, where almost 100 in one factory get 100 people. Now these people are staying across for example, in the metro, meaning when you do contact tracing, they will have infected, some of them, the people that they are with in their public transport, plus also where they reside, especially if they are the labor force or workers that stay in high-density communications. So that's why it made us to have many of these cases just in one go. But now it made us to actually do case finding in terms of determining the testing. What does it mean? It means instead of just going to an area, just do random mass community testing and tracing, where it's likely that you might not get as many that are infected, but you just go exactly to the area because there have been cases that have been detected in that kind of that's where you find that the contributions of the large numbers are.
All right, so one of the things that we've noticed as well is that you're able to roll out so many more tests than the other provinces. How have you been able to do this? What is it that you're doing?
Actually, we would have wanted to roll out more per population, per capita, if the testing capacity in terms of the labs were ready. Because now we have got a backlog of where the results take a week or so or more for the people to get the results. So it means that what is the point of intensifying the testing? So that's why we today, actually, when I'm done here, I'm meeting with is already here, the National Health Minister, where we will share our strategy going forward. Because there's no use of waiting for the results for a long time. You will have infected as many actually during that time. So yes, again, it links up with in terms of the capacity of us testing more per capita. It's because of those clusters where you just go directly to where you find the case. And also noting that also the Western Cape, the level of infection has also increased. So the epidemic is here. It came early for the Western Cape. So you mustn't also look in terms of that. It's only the testing. It's many ways. It's a testing capacity which we have done, where we've conducted as many, but also taking into consideration that we have got a large number of the clusters where positive cases were there, plus also taking into consideration that the epidemic is here.
All right, so across the Western Cape, have you, which areas are the most problematic? Is it where the metro areas, where are you finding the highest number of cases at this stage?
Yes, it is the metro. The metro is divided into 8 sub-districts. You'll find that the sub-district now, it was initially, you'll find that the western, it starts from the upper run-out of the borders of the Western Cape on the western seaboard, coastal line going down up to town. We've seen many of cases that are there, but if you look in terms of each and every sub-district, there will be a hotspot. Same way we have seen in terms of the Tygerberg area, which covers that part of the Tygerberg Hospital plus a majority of the Cape Flats. And also the Khayelitsha, where we have seen it's going up. But across the 8 sub-districts, you get lots of hotspots that contribute to the large numbers. But you find that there are sub-districts that are quite larger. But noting, it's not necessarily, let me give an example of Khayelitsha. It's not necessary that the infection would have originated there, but because there are many essential service workers who work across the metro, and then when they come to get infected across, whether from the retail shops or whether they're South African police or whether they're the health workers or they're working in the factory, when they come back to their areas, then they ended up infecting as many more. And then the second one outside metro is what's the area called Witzenberg. It's an agri-processing and the farming community where it originated from the prison correctional services.
All right, so at the moment we've got 8,000, nearly 9,000 people, confirmed cases across the country. I thought I heard the Premier saying that you could have as many as 7,000 cases just this week in the Western Cape. And this raises questions of capacity, resources. Are you going to be able to manage all these numbers?
We're doing as much as we can in terms of preparedness. Because we are prepared when it comes to the testing. Plus, also, we have opened up triage centers so that when people, because you don't have to wait when the health workers come and go testing in your community. You can come, but without necessarily putting too much load in that specific hospital in the emergency area. So that's why we have got these triage centers across, which is about 18 of those. It's like a marquee where you have got all the experts where you can be tested quickly, and if you need an oxygen, you can get oxygen. If you need a stretcher or you have to be admitted. We have also opened up the additional beds for the hospital. When we calculated the beds, including those from the private, we realized that we'll have about 1,000 plus shortfall. Hence, we have opened up the CTICC so that we can have additionally about 850 beds. We've got also other warehouse that we have also leased to add more of about 330-something beds, plus also others. And also we have made a point about the issue.
Are we going back? All right. Okay. MEC, thanks so much indeed. I think we might come back to you, but our producers will be on the phone to you because we might get some callers who might have a question for you, but we'll track that just now in the next couple of minutes. But in the meantime, thanks so much indeed. To you at home, a reminder that our question of the day is, has the easing of the lockdown to level 4 made lives any easier for you, particularly with access to healthcare facilities in your communities during this pandemic? Please share your thoughts with us on social media via Twitter using @SABC Health Talk or on our Facebook page, SABC Health Talk. You can also send us your voice notes, of course, on our WhatsApp line, and that's 065 862 4548. Now, after the break, we continue with our discussion with the Western Cape Health MEC, Dr. Nomafrench Mbombo. Stay with us.
Among the regulations was the ban of alcohol during this period.
Alcohol is the thing that makes people to enjoy, to meet each other, but they must respect the rules for government.
You can be able to stay indoors and not actually move around.
Anybody that comes close to alcohol, more bad.
Every South African is a soldier, because each and everyone has to take responsibility to fight this infection.
We have not seen anything as serious as this confronting the entire nation.
1 million people contracting the virus around the globe.
The spread really is quite imminent, and it is a very concerning situation.
The issue of COVID-19 is a reality.
And they turn them into a joke and trend on social media.
Our condolences to all the families who have lost their loved ones.
Everybody should abide by the laws that the government has stipulated.
South Africa has the highest number of confirmed coronavirus cases in Africa.
After careful consideration of the available evidence, the National Coronavirus Command Council has decided to extend the nationwide lockdown.
These people who are fighting the process, they are extending the effect of the lockdown, because if we don't contain this within this time, we're going to find that there will be a greater and greater expansion.
Welcome back. You're watching Health Talk on the SABC News Channel, and we continue with our discussion with the Western Cape Health MEC, Dr. Nomafrench Mbombo, about the challenges in the province. MEC, we've just finished this week that citizens across the country had an opportunity to travel back to their places and this interprovincial travel. I wonder if that's been a concern for you, and if that might influence or alter the projections that you had put into place. Hello, MEC, are you still there? Hello, MEC? All right, it looks like we've lost the MEC for the Western Cape, Dr. Nomafrench Mbombo. Don't forget, let's remind you once again, because we'd love to hear from you. Our question of the day, once again, Has the easing of the lockdown to level 4 made lives any easier for you, particularly when it comes to accessing healthcare facilities in your communities during this pandemic? We had a situation at some stage where people were struggling, especially with the transport to get to their locations. Share with us on social media using our Twitter handle at SABC Health Talk or on our Facebook page SABC Health Talk. And don't forget, we'd still love to hear from you on WhatsApp 065 862 458. That's the number. And we'd also like to get your videos, if you can send them to that WhatsApp number as well. But let's take a look at some of the messages that have started coming through already. And the first one is from Freddie, who says, morning, the easing of the lockdown to level 4 has made people's lives easier to access healthcare facilities, but a lack of water is still a major challenge in Mabalstad village. And up until today, we haven't been supplied with JoJo tanks like other areas. And that is a big concern, of course, because hand washing is one of the central pillars of staying healthy. Thanks for that. Sianda Mda says, yes, the easing of lockdown has made things a bit easier, especially when it comes to movement. What was a bit risky, though, was the window period for this provincial crossings. I fear that COVID-19 positive people found themselves spreading this pandemic. Yeah, that was a big fear, and one that I wanted to put to our MEC. Dr. Musa Mayai says in private practice, it's difficult to encourage patients to come in large numbers. So my solution is encouraging my patients, especially those who are well known to consult using telemedicine. There we go. We've got the technology. It's out there. If we can use it, that would be a great idea. All right, so let's go back to the MEC for the Western Cape, the MEC for Health, Dr. Nomafrench Nombombo. Thanks so much indeed, MEC. One of the questions that has come up from on our Twitter handle, and also that I posed to you just before, but we didn't have you on the line, this interprovincial movement. Has that affected your projections or influenced what might happen and any concerns that you had as a result of that week?
Can you hear me?
Yes, I can hear you now.
Okay, the mistake was I unmuted myself and then I forgot.
Okay.
Okay, I forgot. The movement between Eastern Cape and Western Cape has always been there, even pre-COVID. It's a history. For example, I am from the Eastern Cape. My parents and everything is there. I call Eastern Cape home. I'm here in the Western Cape because of for economic reasons and also for education reasons at the time that I relocated 20 years ago. Same applies with the issue of the essential service workers. Just like previously, they used to be the Eastern Cape and Gauteng in terms of the mines, where there will be someone who will make a call that anyone who wants to go to the mines, whether going to the northwest or to the Gauteng, please come and write your name. So the issue of the agri-processing, where people will be called, what do they call farm scout, the scouts, where they go for farm worker scouting, where we'll go to the villages and ask for the people if they want people to come for the season, for the seasonal workers. So it has always been there, where you know that the season will end right about May or something, and then they go back home, and then they come back again around about August, September, depending on what kind of a produce that they are producing. So it has always been there, because people will be coming here for that 3-month period and go back. And what I know, what arrangements that has happened, which is I visited some of the farms, is about they've got permits as essential service workers. And some of the farms, they make it a point that they even screen them before they left. So it cannot be now that there is COVID, and then it looks as if now the people from the Western Cape are being pushed to the Eastern Cape. Same applies with the issue of the funerals. The permits are being given by the magistrate court or from the police station, so where people could be able to go and attend funerals or bury people. It has always been like that. So it cannot be now that people cannot go and so forth. But however, having said that, It's understandable for any province or any to have some fears and anxieties when people are coming from the high risk areas of infection. So that's why we made an agreement. The two premiers met, and also the minister, MEC for the transport, also had an engagement part of the process where we said we will make sure that specifically now for seasonal workers who have to go back home, make sure that the employers of, if now it's a SMME, in terms of affordability, we have to screen them. Same applies because they will be coming back again in August. So the Eastern Cape has to have that responsibility. But when the people now are breaching the laws and they are getting the permits, then the law must take its course. If anyone would be in a taxi that goes to the funeral and will find that the person doesn't even know the deceased that is been on the trailer, which actually what has been transpired, then it cannot be blamed on the government. Yeah. Government doesn't issue, Western Cape government or any whatever doesn't issue the permits. It's only the SABC and also the magistrate court related to the funeral.
All right. At the beginning of the stage 4 of the national lockdown, the police minister was out and about, and he was concerned with the non-compliance that he saw. I wonder, how has it been in the Western Cape, and have people adjusted to level 4, and how does compliance look now at the moment generally?
But noting even at level 5, I had an issue even with the compliance where you see the gatherings. Gatherings at the shops, it has always been there. Hence, we ended up having a supermarket etiquette campaign so that we could create awareness and educate not only the shoppers, like Shop Wisely, plus also the shop owners in terms of how to put the measures in place. And also the role of the Department of Labour to make sure that they go to these areas where there are workers to ensure that the occupational health and safety measures are being put in place, because it's their responsibility for that, and also for the workers themselves to report such. So that's why, as the department, working with the other Department of Economy in the province, we came up with the guidelines for each and every sector. So when you are working in the garage, you can understand that as a petrol attendant, what can you do in order to stop the spread? Same applies when you are working in the farming agri-processing, or when you are working maybe as even for the teachers, we have done even for the education. So different even for the construction when it opens, what is it that you can do? So we work across and engaging with all these people in this sector so that to provide such guidelines. Yes, even during the lockdown level 5, that's where actually we had even as many of cases because of the clusters coming from essential services, including health workers themselves. Now, this is lockdown level 4. Once we welcome the opening of the space for the economy, because we do need clothes, making an example, people need warm food, but again, it's still going to be worrisome. But the question is about, if now we had these challenges during the level 5, remember, it's not health alone who has got a responsibility to monitor and control the social distancing. You can see in the regulations on the national disaster, it talks about the role of the South African police, the law enforcement agency, the military, the defense, which I've been seeing many actually in most of the parts in the township and the Cape Flats. I only see them in the national roads where they'll stop people from moving in that area, but the most where they are needed is in that space. But you also see the long queues recently for the social grant pay points where you see a lot of the stampedes, the long queues, whether they are going to the ATMs or whether they are going to the shops or whether they are going to fetch their money. But the question is, what is the role of the other departments? Because if now, for example, there is a long queues or there are people that are inside in a health facility and then they compromise the issue of the social distancing, I'm being called to intervene, and it becomes my responsibility to see to that in any of the health facilities, people have to social distance, have to apply these measures. But what is the responsibility when there is a gathering outside the street? It cannot be helped. It should be some other spheres of government, local municipalities, plus also national in terms of the military and the defense.
All right, Dr. Nomafrench Mbombo, thanks so much indeed for joining us, and we wish you the best as you're fighting this pandemic on the Western Cape front. Thanks so much indeed for your time.
Thank you very much, Peter. Thank you.
All right, so that was the MEC for Health in the Western Cape, Dr. Nomafrench Mbombo. So that's the province with the highest number of infections and death rates at the moment. But one suspects, though, once all the other provinces increase their rate of testing to the same levels as the Western Cape, that figure probably is going to start to shift to some of the bigger provinces. But we'll be watching that for you. All right, we're going to take a quick break. But before that, a reminder of our question of the day, and it's this. Has the easing of the lockdown to level 4 made lives any easier for you, particularly with access to healthcare facilities in your communities during this pandemic? You can share your thoughts with us on social media at SABC Health Talk or on Facebook, SABC Health Talk. You can also send us your voice notes to our WhatsApp line, and that's 065 862 4548. Now, after the break, we'll be speaking to our reporter in Kimberley, Ulrich Hendricks, and he shares with us his story of COVID-19, his personal journey from infection to recovery. We'll also speak to the Northern Cape Health MEC, Mase Manupole, about the challenges in the province. Stay with us.
Information.
Yes, information is the most treasured commodity right now as the world battles the COVID-19 pandemic, and who better to consult when you're in doubt than the public broadcaster?
In your time of need, the SABC understands your needs. That is why we will do our best to ensure that you are correctly informed and not alarm you with rumors or unmitigated or unconfirmed reports that are certainly finding fertile ground in the era of social media.
Unconfirmed suspicions such as a 5G causes the COVID-19 pandemic are conspiracy theories. These have never been scientifically proven. Even though radio waves do give computers viruses, they don't give viruses to human beings.
And there is the unfounded belief that COVID-19 does not infect black people. As we're being informed right now, the people most affected by the coronavirus in the US are African Americans. Right here at home, there's plenty of cases of black people infected by COVID-19. So don't ignore warnings given by the health department to look after yourself because you're black.
Be wary of fake news. Under the present lockdown regulations, fake news and misinformation by anyone on COVID-19 are prohibited. However, we at the SABC have always known this. Well, that's why we make sure the information that's passed on to you is verified and thoroughly checked.
In the age of the internet, you need to be very careful whom you listen to. We say for your sober, impartial news, listen to your public broadcaster.
Welcome back. You're watching Health Talk. Now, just over 4 million people across the globe have been infected with COVID-19 coronavirus, and this sadly with over 275 deaths recorded. However, just under 1.4 million people have recovered from the virus, putting the number of active cases at 2.3 million. But what happens when you are being told that you've contracted the disease? Our reporter Ulrich Hendricks in Kimberley tested positive for the virus, and then he recovered. Let's find out his personal story.
COVID-19, also referred to coronavirus, is an infectious disease. Those who fall ill with the disease experience mild to moderate symptoms, and some recover without special treatment. One can be infected by breathing in the virus when you are in close contact with someone who has the virus, or by touching a contaminated surface and then your eyes, nose or mouth. some succumbed to the virus while some recovered. SABC TV News reporter Ulrich Hendricks, a father of 3, first tested positive for the virus after he went on a work trip and came in contact with German nationals.
SABC sent through some questionnaires, which I answered and then gave them. But in that time, I've also developed some cold symptoms, and that come with the fact that I was in contact with the German nationals. The SABC then decided that we should go for a test. That proved to be positive. Didn't expect that because I thought we were just having a bit of a cold.
A turning point in their lives as the family was struck with reality and had to self-isolate, quarantine.
We were very worried. My wife was very worried. Kids didn't really know what was going on. My daughter also very worried because by then the news had come out that we have this thing called coronavirus. It has come to South Africa and now it's in our house. It was very scary, very emotional, scared for the kids, not sure what is going to happen.
I realized now it's my 2 children and my 1 daughter. What is going to happen now? Now it's a serious matter. And after crying and after spoken to the Lord, and then we started to adjust.
With very limited movement, the Hendricks family had to rely on a support structure of colleagues and friends for essential shopping.
Colleagues and friends went out and we would call them, WhatsApp them, and they would go and buy stuff for us. And then they would leave it at the gate. and then so that's how we got essential items to, like food, milk for the kids, juice for the kids, that type of thing, yeah.
After Hendricks tested positive for the COVID-19 virus, this SABC office in Kimberley had to close down temporarily. All staff members were screened and tested, and the office had to be disinfected. Staff members are back, but on a low capacity as required by government's lockdown regulations. For Hendricks, a much needed relief to be back at his desk compared to a confined space.
Getting back to work, it's also nice because you miss being active, because you're confined to 4 walls, so you miss going out. But also, since the time that I was initially sent home to say, okay, you be in self-isolation and go for a test, until I got back to work, life has changed. We're doing stories with mask on, social distancing, wherever we can't, we don't really go into people who has tested positive for COVID-19. We don't go into the houses.
Anxiety kicks in when some have to undergo the test and waiting on their results. But Hendricks says you need to stay calm.
Just be patient, relax. Try to you still follow the advices that government gives us. Wear your mask, stay away from people, try to boost your immune, so your vitamin C's. People also have some traditional ways of boosting immune, like with your garlic, red pepper, and that type of thing. So try and boost your immune system.
Although the Hendricks family had to deal with the reality of being infected with the virus, they overcame the fear and had a positive mindset. And now, life is slowly starting to return to normal, with Hendricks focusing on his usual chores. Reginald Witboy, SABC News, Kimberley.
All right, well, let's talk to Ulrich Hendricks, get another sense of this journey. Ulrich, thanks so much for joining us. I can only imagine that when they told you you're positive, that must have been the scariest part of this journey, wondering what would happen next.
Yeah, because I did have symptoms, but knowing what we know in terms of how far this COVID-19 can progress. So I wasn't sure if I was going to get just normal flu or if I'm going to end up in hospital on a ventilator and people actually die from the coronavirus. So it was very nerve-wracking and very scary because we didn't know where we will be in that in that sphere, because like we said, you might not even know that you have COVID-19, or you might go to a ventilator, or you might die. So it's quite scary for me and the family.
All right. You know, they often say that when you have a life-threatening situation or a major circumstance, that it's life-altering. And I just wonder, you know, you as Ulrich, before and after, has your view of life, the world, and things changed as a result of your experience?
I think, like you said, you tend to look at your life, to look back, what you have achieved so far, and what I think is the biggest achievement for me was my kids and my marriage to Kathleen. And so, you tend to focus more on those things. You tend to try and focus on your kids, your wife, and your immediate family, your friends. Just those things in your life that really does matter. But that doesn't mean that I didn't miss the job, like I said previously. It's amazing thing to do stories, to tell people the news of the day, especially in the Northern Cape. But yeah, like you said, it's a big thing. It really tells you to focus on what's important.
All right, and perhaps finally, because you have the opportunity to speak with hindsight, what would be your advice to people who've just been told you're positive? What would you like to have been told at that point that might have made the journey a bit easier?
Like I said before, it's that you don't know how this illness or disease is going to progress. But I got a call from a doctor, I think 2 weeks after I've tested negative the second time. And then he gave me advice in terms of how to boost your immune system. So do some research, speak to your GP or to your health professional in terms of how to boost your immune system. Also in terms of, I was very scared that I didn't do the self-isolation correctly because of the small kids that we have in the house.
Right.
So, and the health department only came after the positive diagnosis. So I would have liked to have known those things before, so that, because like I said, I was very scared that I didn't do it correctly. So it's also a nice thing for people to know how to do it once you just have, once there's the scare that you might have COVID-19.
All right, so get educated as much as you can. Ulrich, thanks so much indeed. It's so good to see you healthy and happy on a Saturday morning. And thanks so much for the great work that you're always producing out there in the Northern Cape. Thanks so much, my brother.
Thank you, Peter.
All right, that's our reporter, Ulrich Hendricks. And I was joking with him that the reason he survived so easily was because he's young and he's handsome and good smile on him as well. All right, let's hear from you now, because you've been calling and sending us your messages. Let's take a look at the first message that's come on WhatsApp, and that's from Kurt, who says, "Good morning. The easing has worked both ways, access to health and also increased the virus. People have taken advantage in the wrong way, though, and today the country is bleeding because of that. Implementation of the COVID-19 rules can save us, but unfortunately police and and army, especially where I stay in Umsombomvu, is very poor. The next message is this one. Hi, I'm Gumani Mbedzi from Rudaport, and that's in the West Rand in Johannesburg. Honestly, the easing of this regulation, I think, it has led to a drastic increase of infections. I wish Mr. President can extend the lockdown to 6 months with extremely high measures. And in Cape Town location, it's like a new year. The spreading of the virus is very high. Please, let's go back to level 5. All right. Okay, so those are some of your messages, and we've got a caller on the line now. Bulana, thanks so much indeed for joining us. How has life changed for you as a result of going from level 5 to level 4?
Peter, I must say good mornings first. And really, we appreciate what you guys are doing. It is a terrible situation, and we cry out for people to stay at home and keep social distancing. But the worrying factors is what your earlier interview with Dr. Noma French Mbombo. Western Cape is putting the truth forward. I think Gauteng and KZN is playing a political game here, which is very dangerous. They must become honest and show their figures what we have reached so that the people can learn from that and stay more indoors. You know, they remind one of what is happening in New York. New York has been playing honest under Governor Cuomo, and now the others are suffering because they tried to hide figures on their problems. Here we've got a very, very serious thing, and I'm praying. Only God knows what is going on. As long as we keep our social distancing, we'll be fine. And I'm also saying to Ulrich Hendricks, he must keep on praying. He will be fine with his family. Thank you, Peter.
All right, thanks so much indeed for coming through. So one of the things that keeps coming through, people are saying that we should have kept the lockdown for much longer. And we're talking to a vaccinologist this past week, and he says, look, keeping it for longer is not going to help. The issue of the lockdown was to flatten the curve. It seems that we can't stop the virus, and by the next 12 to 18 months, it's quite likely that as many as 50 to 60% of South Africans will have the virus. So that's not what the issue is about, the lockdown. The lockdown is about flattening the curve so that the health system isn't overwhelmed when we peak with the virus infections. So don't think that the lockdown is going to stop the spread. All it will do is slow it down. Okay, now what are we doing now? We got the MEC for the Northern Cape to chat to us. It's one province that hasn't really had the numbers that we've been seeing in other parts of the country. And we're now joined by the Northern Cape MEC for Health, Mase Manopole. Thanks so much indeed for joining us, MEC. Welcome to the program.
Good morning, and thank you very much, Mr. Pitandoro.
All right.
And good morning to all South Africans.
So some might say that the Northern Cape has done well in managing the COVID-19 pandemic, or is it you don't know the true extent of your problem?
Not necessary. If we were aware that the presentation that was made, Professor, we have 8 stages in response. Been on stage 4, we are moving now on stage 5. Remember, as we move on, we are doing some work as per the stages. The lot of screening has been done, then we're testing. So I believe that we have been good work that's been done. That came up. But as we move stage 5, remember the lockdown of level 5. It was just to ease the It's a problem of the sound. There's somebody at the background that is talking, Mr. Doro.
We're having an issue with the sound there. And what we're going to try and do is get back to her as soon as we can, and we might even have to use the phone. But if you've got any questions, please drop them to us, particularly if you're in the Northern Cape and you've got an opportunity there to speak directly to the MEC there. All right, so let's get a look at some of your messages that have been coming through. And we've got this one that's saying the easing of the lockdown has made things easy, but now people have lost their fear of risking their lives. And if you look at yesterday's stats, it's traumatizing. I think that we should go back to level 5. And of course, yesterday with a huge jump in the numbers of people. But level 4 is helping a lot. Exercising in the house was not enough for my body. Yes, Sam, we're seeing a lot more people jogging in the mornings and on their bicycles, that's for sure. Now, good morning. Let's just go back to the one before, because we didn't read that message. The one just before. Yeah, there we. Okay, so good morning. The easing has worked both ways. Access to health has increased the virus. People have taken advantage in the wrong way today, and the country is bleeding because of that. Implementation of the COVID-19 rules save us. Unfortunately, in fact, I think we've read that much earlier. So those are your messages. Thanks so much indeed for sharing your thoughts with us. And let's go back to the MEC for Health in the Northern Cape. Thanks so much, MEC, for your patience. Let's go back to what we were talking about earlier about, and you were explaining the different stages and the different levels, because the question I put to you was, you have low levels of infections in your province, and was that because of good work, or is it that you just don't know how big your problem is as yet? And you were explaining to us, but sadly we missed parts of your explanation.
Okay. The explanation continue is a bit of both of the work that we're doing as a province. Remember the stage 4 saying that there's a good work that we're doing with regards to the screening and testing. If we are aware that already we are over 666,000 under our screening that have been done throughout the province. And then we are in line with the programs of our national with stage 4. Remember, stage 4 was also just giving us time to prepare for stage 5 and 6. So there's a reason why in stage 5, where we'll be able to see more numbers of a possibility of more numbers to rise, because of we have been make some preparation for stage 5. Hence, they're saying there's a bit of both. There's a good work that we're doing by screening and testing the right people. Now, when we're in stage 5, we're going to do hotspot and be able to identify the hotspot and then screen and test all of them, as we have been in stage 5. Stage 5 says active surveillance, active in going out and get the cases. So that's the reason why the purpose of the lockdown. The lockdown was also making us to prepare for the stage 5.
All right, MEC, sadly we've run out of time, but thanks so much for your patience and for sharing your thoughts with us. That's the MEC for Health in the Northern Cape. And that's sadly how we come to the end of this edition of Health Talk. Join us again next week at the same time for more of the same. In the meantime, wash your hands, social distance, and wear your mask. Stay safe. Bye-bye, everyone.